Hello and welcome to Organon-Hub. So today we are going to start the case-taking aphorism, and the context is the 5th edition of Organon. Okay, so the case-taking aphorisms ranges from the 83rd to 104th. Now let's read it once. The individualizing examination of a case of disease, for which I shall only give in this place. I means Dr. Henneman is saying that in this place, the only thing that he can give is the general directions, of which the practitioners will bear in mind only what is applicable for each individual case. Demands of the physician nothing but freedom from prejudice and sound sense, attention in observing, and fidelity in tracing the entire picture of the disease. Now, if we want to understand this aphorism, let's divide it into 5 parts. First, individualizing examination. Second, general directions. Third, freedom from prejudice and sound sense. Fourth, attention in observing. And last, fidelity in tracing the entire picture. Fidelity means accuracy or the faithfulness towards our pathy, which helps us in tracing the entire picture. Okay, so the first one is individualizing examination. So Dr. Henneman is reminding us that no two patients are identical, even if the diagnoses are the same. So our job is to catch what makes this specific patient's disease unique, not what is common. Okay. The second is general directions. Simple hai, apply only what fits each case. So homeopathy is not applied mechanically. है ना? You don't have to force a rule onto the case. We just have to extract the case what is relevant. Okay, a good physician knows when a principle applies and when it does not. Third is freedom from prejudice and sound senses. Now this is the hardest part for beginners. It means that don't assume the diagnosis explains everything. Don't let our favorite remedy bias us, or else don't interpret symptoms based on our imagination. We must see the patient as they are. That's it. Nothing else. Not as we expect them to be. Okay. Fourth is attention in observing. Deep, calm, sharp observation karna hai. This includes the tone of voice of the patient. These things are of the patient, hai na? This includes the tone of voice, the gestures, the expressions, the emotional reactions, the modalities, timelines, everything. Remember, most mistakes in homeopathy come from careless observation. The last one is fidelity in tracing the entire picture. Now, our job is to draw out the full pattern. Full pattern includes what? The mental symptoms, the physical generals, the particular complaints, the modalities, sensations, causations, past history, family history, habits, temperament, no doubt everything. A true picture emerges only and only when we stay loyal to what the patient actually tells us, not what we think they should be like. Okay? So if we want to summarize it in simple words, we can say that every patient is unique. है कि नहीं? Every patient is unique. So we must study each case individually, not with a mixed formula. We have to use only what fits that specific patient. The general rules are helpful, no doubt, but they don't apply to everyone. Third is we have to keep our mind clean. No assumptions, no biasness, no favorite remedy in mind, no imagination at all. Observe carefully, notice every detail, what the patient says, how they say it, how they behave while saying, what makes their symptoms better, what makes their symptoms worse, everything. And then collect the full picture. Don't pick just a few symptoms. Take the whole story, the mentals, the physicals, generals, particular, past history, everything. Okay, so that was aphorism 83rd for you. It teaches us that the physician's greatest strength is not the remedy but the clarity of observation. So before you scroll to watch the next aphorism, don't forget to subscribe Organon-Hub, where principles meet practice.